Thank you, David, for the introduction. Astrid Young did the injury and illness part of this, and so I decided I wanted to do something a little bit more novel, and translating the knowledge to the athletes and the coaches is really the end and the most important part, that we can get the information, disseminate it. Most recently, we have full support for the Sports Medicine Committee to go and, do things here. We've tried to disseminate it in the past on our web pages. The World Aquatics magazine, there's a medical corner in the glossy, and we had a newsletter, but we're going to have web pages and things will change every month, so we'll get it out that way, and hopefully we'll have more conferences like this is the idea. Okay, so this PowerPoint presentation is going to have a whole bunch of different templates. Some of it's going to be colorful, some of it's not, and I want you guys to think about what would catch your eye, because getting athletes to read something is tough. If you look in your bags that you got, there's a good example. Thank you, Dr. Mon, for that presentation on nutrition. If you look in your bag you got, there's a little easy-to-read translation from scientific journals so that athletes, coaches, and anybody that's not pure science, it's targeted towards. So not just in the scientific literature. Rather than it waiting 10 or 15 years to get out of that, we've got to be vigilant about disseminating the knowledge. So first I'm going to talk about common injuries in the aquatic athlete. I'm going to go fast through this because really Dr. Young did a great job with this. Risk factors of an injury, brief history of injury and illness surveillance studies. Mine will be a bit more glossy. That's examples of injury, surveillance, prevention through intervention. The shoulder injury will be our example here. And then the summary. So, common injuries, the shoulder, by far and away the most common, lumbar spine, wrist or hand, I'd say more common in diving, ankle and foot, knee, in all of the sports, because of the egg beater, elbow, cervical spine and neck, and again, obviously traumatic usually, and only in certain sports, so aquatic sports anyway. This is purely diving, is the rupture of tympanic membranes by landing on your side and on your ear. You can only have that happen so many times before it's a career-ending injury. Retinal detachment is also common in comparison to the normal population, and once you've had one, you can go back twice if it wasn't so severe, but even the first one can be career-ending. And lacerations and concussions, water polo, synchronized swimming, and diving. Okay, so risk factors for injuries. Abnormal biomechanics eventually are going to give way to some sort of unequal areas of the body and just promote injury. Overtraining if there's not enough of a rest period. And also a rapid increase in training, which is also overtraining. Environmental factors, I think they've been covered here a lot. Open water swimming is very much affected, but it also is about what is the equipment, is it safe? Illness, and then psychosocial or psychological risk factors, which is my specialty. So if an athlete has a loss or financially is strapped or they're depressed, they're at risk for injury. They're not going to concentrate as much, and you find them not coming to practice as much, or they might be irritable, so they're not listening, and that's when you have injuries. Chaos, basically, creates injuries. If chaos is out there in their personal life, be careful in the pool. So Athens was the first time that a study was done, and again, Dr. Jung mentioned this. It was acute new onset injuries in all team sports. And there we are with water polo, but I've listed the other teams. Next, we go to Beijing. That was the centerpiece for me there. And an injury incidence in all the teams and individual sports was done there. And then along came FINA with its first study, and we had some help with some funding from the IOC as it was a pilot for them. And now I've changed the slide again. What's more appealing to who? And thank you, Ron, if this is where that came from. You had one of these. So that we did a study in Barcelona, and we did do a retrospective with the athletes and asked them to fill out forms for 4 weeks prior to the championships. And the medical teams were recording the prospective problems or acute injuries or illnesses. 177 participating countries. Now, I'm not really going to go through this because I think Astrid did a good job, and for the sake of time, I think we're a bit behind. No, it's okay? Okay. So in progress, the Sports Medicine Committee is very much working on prospective studies, as Astrid Young has said, really we need to be doing more of. I think everybody's said it. So I'm going to, just for a second, I've mentioned that we have the web pages that they're just getting redone that we will disseminate stuff with. And I've mentioned that we had a newsletter, but that's going to be replaced with updating every month the web pages. And we also have conferences. So we started to think, what other ways can we do it? Well, the glossy booklet was one. Well, we came up with videos. The shoulder video is done. I have a clip of it here. And to be released, they've been done for quite some time. The swimmer's knee, the lumbar spine, and concussions, complete with return to play protocols for water polo, synchronized swimming, and diving. Oh, sorry. There we go. And again, I'm going to skip over this. This was just the results, the disciplines in Rome, showing that diving actually had the most acute injuries there, women's water polo. But as she said, different studies show different things over time. Okay, so we have a duty, FINA, in its accomplishing its mission, should take care that sport is practiced without danger or problem for the health of the athletes, and to that end, it take measures necessary to preserve the health of athletes and to minimize the risk of physical injury. So, prevention of shoulder injuries in the aquatic sport, as I've said, much of the scientific literature states that it's the most common injury in the aquatic sports. The following video is a tool that can be used in aquatic athletes to decrease the incidence of shoulder injuries in the aquatic sports. And as I said, it's very much targeted, and when you'll see the clip, for athletes, coaches, team physicians, and other members of the healthcare team. Okay, so shoulder injury prevention video, but before I do that, I'm going to go back to the basic. Again, I'm switching slides. So we have to establish the extent of the sport injury, so we need injury and illness studies and what's the cause. And then we have to introduce a preventative measure. For us, it's video. And then we have to assess the prevention intervention step to see if it's working, and so the circle goes. Now, can you hit the... Got it. Here's a clip of the video. there's quite a lot of bling. Watch
The
for
shoulder
certain
joint
moves,
injury
especially
is
in
the most
synchronized
common
swimming.
injury seen in all of the aquatic disciplines of swimming, synchronized swimming, diving, open water swimming, and water polo. This video will describe how the shoulder joint functions and then show a series of exercises to best protect the shoulder from injury and prevent time lost from training and competition. On first glance, the shoulder and its surrounding tissue appear to look simple. The two main bones of the shoulder are the humerus, which is the long bone of the upper arm. The scapula is known more simply as the shoulder blade. The bony joint cavity is known as the glenoid fossa. Ligaments connect the bones of the shoulder, and tendons join the bones to surrounding muscles. The biceps tendon attaches the biceps muscle to the shoulder and helps to stabilize the joint. Other shoulder joint stabilizers are the four short muscles that originate on the scapula and pass around the shoulder, where their tendons fuse together to form the rotator cuff. While the shoulder joint is categorized as a ball and socket joint, the socket is shallow. It resembles more a golf ball on a tee than a true ball inside of a socket. Although this puts the shoulder at a greater risk of injury, it gives the shoulder an amazing range of motion.
That was it.
The disadvantage is that many forces can combine to make the joint more unstable and result in joint damage or failure. It is surprising to realize that the true power source for the shoulder comes from the upper back and abdominal muscles and not from the shoulder itself. The shoulder blade transmits these forces through the shoulder to the athlete's arm for swimming, throwing, lifting, and a myriad of other activities required in all of the aquatic sports. The athlete should not wait until the shoulder is sore to begin these preventative exercises. While there are many problems that may cause shoulder injury, the most common problems include poor technique and a sudden increase in training. These following exercises address the three important anatomical areas. The muscles of the low back, abdomen, and pelvis make up what is known as the core muscles of the body. The side plank raise focuses on building the lateral sides of the core. This exercise is performed with the athlete on their side with a towel or a mat. The support arm should be directly under your shoulder with the remainder of your body in a straight line stretched out with a good posture from the hips down. Lift the hips off the ground until the body is in a complete straight line. Remember to achieve symmetry. The other arm can be at your side or raised to a T-like position to make the exercise more difficult and is a more advanced form of the exercise. Repeat the exercise 3 to 6 times for 30 seconds.
Okay, so the summary is injury and illness surveillance studies are an important tool to discover the extent and cause of injuries in the aquatic sports. Notice how I've written it in a much more friendly for athletes and coaches. This allows preventative measures to be put in place. One needs to follow up and see if the preventative interventions have been effective by making the materials available. And that's an example of me taking scientific words and putting them into like a lay article I would do for the FINA World Aquatics magazine, so it's understandable and aimed at the coaches and athletes and the athlete entourage, whoever else is involved. Oh, thank you very much for coming in there. That was supposed to be another change in.
Sure. Well, thank you, Saul. And are there any questions for Dr. Marks? A question over here? Would you mind just waiting for the microphone so we can hear? Thank you very much.
Walter from Jamaica. I think it's a great video. It, gave a lot of helpful information as to the sort of exercises we should do to prevent shoulder injuries. But if you follow the video and do all the exercises on the video, takes a very long time. And my practical problem trying to give the information to my coaches in Jamaica is that there isn't a sort of set, that has been recommended. In other words, you go to a trainer and he gives you a program. He gives you a program that, your swimmer can do. And that's the difficulty that trying to get my coaches to do it, because they would have to select which exercise to do to add to their programs. And they don't have necessarily that technical knowledge to decide to do which exercise when.
Okay.
So if we could extend this video by giving suggestions as to training programs that you can add to your land training sessions, I think it would be helpful.
Yeah. If you watched this video, obviously. Okay, so if you listen closely, it does say what's an easier form of the exercise, or that you can start up with less reps. And you could choose to do 2 of the 4 exercises. They're all working the same area. And if they can't get through 3 sets of 10, then they should try maybe 2 sets of 10 or 3 sets of 5 and slowly work their way up. And I think that if a coach knows that we're saying that that's someone who's an elite athlete in shape, they can do that. But we do say it's graded, and we do talk about what is the most, and you could do less. And we tried to give easier forms of the exercise and mention what the easier form was. So I'm not sure. I think it's a coaching decision. Like, we gave 4 exercises for each, and it's really up to your coach and how much time you have and also the athlete's ability to move forward.
Well, look, in the interests of time, we'll have to call the session to a close now. But in so doing, I think you've enjoyed and heard from a bunch of international experts in their fields. And would you join me one more time in thanking the speakers for this session?